Okay, I think we're going to start. I want to thank everybody for joining us today. We haven't done a webinar in a few months. We were doing webinars throughout the spring when things were closed down. But once we got open, we decided to focus on treatments. But now we are very pleased to have a webinar discussing medical scalp micropigmentation and microblading. A lot of women are familiar with microblading of the eyebrows, but micropigmentation is also a treatment that has been utilized for hair loss coverage for probably about 5 years. We are incredibly fortunate to have Nelly Karashi with us, who is not only a fantastic technician, but really an artist and also just a lovely woman to work with. We've been doing micropigmentation for a couple years now here, and the patients overall are very, very pleased. So welcome, and there'll be a lot of information that you'll be learning. What I would ask that if you have questions that you actually put them in the Q&A section. We will be answering questions at the end of the presentation. The chat area is really used for if you're having concerns or issues regarding the webinar, if you're not hearing properly, or if you have a question that needs immediate attention. But for questions for myself and Nelly and Diana, please use the Q&A section. So again, welcome. We will be giving a little bit of background on the female hair loss, and then Nelly will pick up and do micropigmentation and microblading discussion. And in addition, we will be doing a live treatment today. Our nurse practitioner, Diana, who has been very involved in all of our webinars and very experienced in treatments here, has kindly offered to allow Nelly to do a treatment on her. So you'll be able to see how it works, and they will be able to answer questions right after the treatment. Okay, just a quick hello to all of you. I'm Dr. Mary Wendell. I'm the medical director of Medi Tresse. As I said, Diana Gallerani is our nurse practitioner, very experienced, and has kindly offered to be our patient today. And Nelly is our micropigmentologist, and you will be seeing more of her shortly. I'm going to briefly talk about female hair loss, very briefly, but just to emphasize that virtually all types of hair loss, for the most part, can be treated with micropigmentation. And some of you who have been undergoing treatment for hair loss probably are wondering, can you have the micropigmentation along with it or during treatment? And the answer to that is yes. Like all treatments for hair loss, we do individualize it, and timing would be important. But those treatments can take place in conjunction with micropigmentation. But just quickly, for those of you who haven't shared many of our previous webinars, there are 3 phases of the normal hair life cycle. The anagen phase is the growth phase. That's the one that lasts several years. And then you go into the catagen phase, which is the transition phase where the hair starts to retract from the follicle. And then the telogen phase is the resting phase, and then followed by the shedding phase. And shedding phase can last anywhere from 3 to 4 months. We know that over time, a variety of hair loss issues, particularly genetics and aging, tends to shorten the growth cycle so that you are actually shedding more hair at any one time. The kinds of hair loss that we see here at Medi Tresse really involves all types of hair loss. Most commonly, we see androgenic alopecia, which is also known as female pattern hair loss. That's a genetic form. We see a lot of telogen effluvium. We've seen a lot of it, particularly during the COVID pandemic, because the stress that everybody's under has actually caused a lot of shedding. We've actually seen telogen effluvium in our COVID patients as well, and they tend to have a fairly pronounced episode of telogen effluvium or shedding, but it does resolve, which is good. Traction alopecia is hair loss due to certain hair care practices, and this is an area where micropigmentation can work very well along with standard treatments. And then alopecia areata are the areas where you have actually bald spots that can sort of converge to larger areas. We do see a fair amount of scarring alopecia, which is increasing in incidence over the last 10 years. There are probably some reasons for this. Some of it is hair care practices, and some of it is hairstyling. Some of it could be related actually to some sunscreens, which is incredibly disappointing because we all do need sunscreens to maintain good skin. But again, more research needs to be done to further define that. Treating female hair loss, again, the first part, most important piece is getting a good thorough evaluation by somebody who knows about female pattern hair loss. We get a complete medical history and a complete hair loss history. We do a very careful physical examination of the scalp and the hair. We do an examination called trichoscopy, which involves a magnification of the hair follicles and the scalp so we can actually see what shape the follicles are in, and it really helps us determine the diagnosis. We oftentimes will do blood work, particularly in a case of a telogen effluvium, where we don't know the cause of the shedding. A lot of times there can be some nutritional issues that only blood work would determine, as well as some hormonal issues, including thyroid, estrogen, testosterone levels. We have biopsy listed there. We rarely do a biopsy when the diagnosis is not obvious and treatment is very much dependent on the diagnosis, then we will proceed with biopsy, but it's not particularly standard. Again, the treatment plan varies significantly depending on the type and the diagnosis of hair loss. So it's important that we get that diagnosis before making any recommendations for treatment. Okay, I'm going to pass this over to Nellie, who is our expert on micropigmentation and microblading. We will do questions at the end once the treatment part of it is, or even during, depending on where they are in the treatment. So hold your questions till then.